Hello and welcome. My name is Renee Riles. I am a Medicare sales representative with Capital Health Plan. During this presentation, we will talk about Capital Health Plan Advantage Plus HMO and Capital Health Plan Preferred Advantage HMO, which are both Medicare Advantage plans. Capital Health Plan offers another Medicare Advantage plan called Retiree Advantage. Retiree Advantage is offered by certain large employer groups, and it allows Medicare-eligible retirees to continue their employer coverage. The groups offering Retiree Advantage include the state of Florida, city and county governments in the service area, school boards in the service area, plus Tallahassee Memorial Hospital and Tallahassee Community College. If you are a member of one of these groups, you may want to attend our Retiree Advantage presentation as well. We were the first health maintenance organization and nonprofit health plan in the area. We enjoy an affiliation with Florida Blue and the Blue Cross Blue Shield Association. You will see their logo on our member materials. We are very proud of the fact that Capital Health Plan has received a 4.5-star rating out of 5 stars from the Centers for Medicare and Medicaid Services for 2019. Medicare evaluates plans based on a 5-star rating system. Star ratings are calculated each year and may change from one year to the next. Star ratings are based on quality and performance. Additional information on plan ratings is available at www.medicare.gov and in your enrollment guide. You become Medicare eligible at age 65, or you may become eligible earlier due to a disability or end-stage renal disease, which is permanent kidney failure. To enroll in Medicare, contact the Social Security Administration. The address, office hours, and phone numbers are on this slide. You can contact the Social Security Administration up to 3 months prior to your Medicare effective date. However, you will automatically be enrolled in Medicare Parts A and B if you are receiving Social Security benefits prior to becoming Medicare eligible. See our Medicare Made Easy brochure that is located on our website, www.capitalhealth.com/Medicare, for additional information about how and when to enroll in Medicare. With Medicare, you have choices in how you receive your medical and prescription drug coverage. You may choose to have Original Medicare through the federal government, which is Medicare Parts A and B. Because Original Medicare does not cover prescription drugs, individuals must purchase a separate prescription plan, which is Medicare Part D. Some individuals also choose to purchase a supplement or Medigap plan to pay costs that Medicare does not cover. Capital Health Plan does not offer standalone prescription drug plans or supplement plans. Another option is to choose a Medicare Advantage plan, which is Medicare Part C, like Capital Health Plan Advantage Plus or Preferred Advantage. A Medicare Advantage plan contracts with the federal government to become responsible for your Medicare benefits and services. Our Medicare Advantage plans provide your hospital, physician, and outpatient coverage, along with prescription drug coverage, which is Medicare Part D, all in one plan. You pay co-payments or co-insurance when you access services, and Capital Health Plan pays the healthcare providers. There are other options as well for individuals who have VA benefits, TRICARE, or employer plan coverage. To be eligible to enroll in Advantage Plus or Preferred Advantage, you must be entitled to Medicare Parts A and enrolled in Part B. You must continue to pay your Medicare Part B premium to the federal government. This means you will pay both the Medicare Part B premium, which is typically deducted from your Social Security benefits, and the Capital Health Plan premium. According to federal guidelines, we cannot accept new members who have end-stage renal disease or permanent kidney failure. If you are a member of Capital Health Plan and have end-stage renal disease, you can convert to a Medicare Advantage plan, and if you develop end-stage renal disease once you are a member, your medical care will be covered. And you must live in the service area, which includes the Florida counties of Calhoun, Franklin, Gadsden, Jefferson, Leon, Liberty, and Wakulla. These are the only enrollment requirements. You will not use your red, white, and blue Medicare card while you are a Capital Health Plan member. We will send you an ID card that you will use to access your care. You are still enrolled in the federal Medicare program, meaning you have all the rights and protections of the federal Medicare program, while Capital Health Plan is providing your Medicare benefits and services. When you join a Capital Health Plan Medicare Advantage plan, you must use Capital Health Plan network providers except in emergency or urgent care situations, or for out-of-area renal dialysis. There are also times when you may receive prior approval to go to out-of-network providers. Routine care from out-of-network providers will not be paid for by Medicare or Capital Health Plan. We have over 450 physicians, including primary care providers, specialists, other facilities including exclusive access, and about 300 specialists in our network. Capital Health Plan has a very well-established, stable network of providers, and we have a good relationship with the medical community. You are most likely already seeing a Capital Health Plan network physician. If you need a primary care physician, you can choose a primary care physician from the Physicians Group of Capital Health Plan located at our Governor Square Health Center, our Centerville Place Health Center, and our new Metropolitan Health Center. Or you may choose an affiliated physician who has a private practice that we contract with. Referrals are not normally needed for office visits or consultations with network specialists. If a specialist recommends additional services, office visits, diagnostic tests, surgery, hospitalization, or other specialty care, you may need authorization from Capital Health Plan. You can always contact your primary care physician or Capital Health Plan member services if you have questions about the referral or authorization process. For a complete list of network providers, visit our website at www.capitalhealth.com/Medicare or call member services. The provider network may change at any time. You will receive notice when necessary. You can use our local hospitals, Tallahassee Memorial Hospital or Capital Regional Medical Center. Select Specialty Hospital is in our network and located in Tallahassee as well. The Calhoun Liberty Hospital in Calhoun County and Weems Memorial Hospital in Franklin County are both in network for emergency, stabilization, and transfer services. We also work with Shands in Gainesville and other centers of excellence on a case-by-case basis. Services at these hospitals require approval and authorization. Capital Health Plan members use LabCorp laboratory services. There are facilities throughout Tallahassee, including one in each of our health centers. You may use any LabCorp in the country. You can schedule appointments at some LabCorp facilities by calling or visiting their website. We have also contracted with facilities in a few of the other counties to provide lab services for member convenience. Capital Health Plan's pharmacy network includes all of the major retail chains, as well as some of the smaller local pharmacies. You may use any network pharmacy nationwide. We also have a mail order pharmacy through Prime Therapeutics, who contracts with Walgreens Mail that you may use. There is a cost savings if you order a 90-day supply of your maintenance drugs through mail order. The network also includes long-term care pharmacies and home infusion drug coverage. You must use network pharmacies except under non-routine circumstances. You can visit our website at www.health.com/Medicare for a complete listing of pharmacies or call member services for assistance. The pharmacy network may change at any time. You will receive notice when necessary. Emergency care and urgently needed care are covered anywhere in the world. You are not required to use Capital Health Plan providers in these situations or call first for authorization. You should go to the closest urgent care facility or emergency room. You will show your Capital Health Plan identification card, and it is helpful if you can call Capital Health Plan member services within 2 days of accessing inpatient care outside of the area. One thing to note is that we are not allowed to cover Part D prescription drugs at retail pharmacies outside of the United States. The definition of medical emergency and urgently needed services is on this slide. Capital Health Plan provides options for urgent care when immediate help is needed, but not serious enough for the emergency room, and your primary care physician is not available. Same-day appointments are available by phone at Capital Health Plan's urgent care at our new Metropolitan Health Center. Urgent care is open Monday through Friday from 11 a.m. until 10 p.m. and is on Saturday and Sunday from 9 a.m. until 8 p.m. Holiday hours may vary. Telehealth through Amwell provides urgent care at any time from right where you are. The Amwell app gives you access to a doctor 24 hours a day, 7 days a week, and 365 days a year. See the doctor one-on-one via smartphone, tablet, laptop, or desktop. Your guide to enrollment includes a summary of benefits. For each benefit listed, you can see what our out-of-pocket costs will be. Our members receive benefits that Original Medicare offers, plus additional benefits. The enrollment guide also includes an enrollment application, an envelope to return the application, and an enrollment checklist. Additional information about our star ratings and non-discrimination notice. It is important to remember that enrollment checklist, which will tell you how to enroll. Please take time to read the guide to enrollment for additional coverage and cost-sharing information. The monthly premium amount for Advantage Plus is $34 and is $96 for Preferred Advantage. You pay this amount to Capital Health Plan. Like we discussed earlier, you must also pay the Medicare Part B premium to the federal government. This slide and the next slide compare Capital Health Plan Advantage Plus and Capital Health Plan Preferred Advantage. These two slides list your out-of-pocket costs for medical services. There is more detail in the summary of benefits that is included in the enrollment guide. We will discuss prescription drugs separately. For most services, you will pay a copayment, which is a flat dollar amount, or a coinsurance, which is a percentage of the cost. Most of your out-of-pocket costs are copayments, so you know how much you will pay prior to accessing services. It is important to know that both plans cover the same services, but there are 5 differences in your out-of-pocket costs between the 2 plans. These are the differences you need to understand to make a decision about which plan will be best for you. 4 of the differences are on the first slide. There are no deductibles for our plans. There is a $3,400 annual medical out-of-pocket maximum for both plans. This is the maximum of copayments and/or coinsurance you will pay for covered medical services in the calendar year. Most members will not reach $3,400 in a calendar year, but if you do, you will not pay for covered medical services the rest of the year. Outpatient Part D prescription drugs are excluded. For Advantage Plus, the inpatient hospital copayment is $250 per day for days 1 through 5, with a maximum copayment of $1,250 per admission. For Preferred Advantage, the inpatient hospital copayment is $300 for a 1 through 5 day stay. If you stay longer, you will pay $100 per day for days 6 through 10, with a maximum of $800 per admission. Skilled Nursing Facility has a $20 per day copayment for the first 20 days, then $100 per day copayment for days 21 through 100 with Advantage Plus, and $75 per day copayment for days 21 through 100 with Preferred Advantage. The copayment for a primary care physician is $10 per visit for both plans. The copayment for a specialist is $40 per visit for the Advantage Plus plan and $25 per visit for the Preferred Advantage plan. The copayment for cardiac rehabilitation is $40 per visit for Advantage Plus and $25 per visit for Preferred Advantage. The copayment for pulmonary rehabilitation is $20 per visit for both plans. The copayment for procedures in a doctor's office or ambulatory surgical center is $150 per visit for the Advantage Plus plan and $100 per visit for the Preferred Advantage plan. 4 of the differences between the 2 plans are listed on this slide. All other medical costs are the same. The out-of-pocket costs seen on this page are the same for both plans. The copayment for services provided on an outpatient basis in a hospital is $300 per visit. There is no cost for the Medicare-covered preventative services such as your annual flu shot. Emergency room copayment is $100 per visit. Urgent care copayment is $20 per visit and $15 for telehealth visit. Diabetes testing supplies has a 20% coinsurance. Durable medical equipment has a 20% coinsurance. The copayment for CT, MRI, PET, thallium, and nuclear cardiology scans is $100 per visit. There is no copayment for routine and diagnostic lab and X-ray services. Part B drugs has a 20% coinsurance. There is more information about these services in the summary of benefits. Capital Health Plan uses a formulary, which is a list of covered drugs. Some restrictions may apply to some of the covered drugs. The restrictions include prior authorization, which means you need to get approval before you fill a prescription, quantity limits, which means the amount of a drug will be limited unless you receive an exception, and step therapy, which requires you to try certain drugs before we will cover another drug for the condition. Additional information about these restrictions for each drug are in the formulary. If you find that your drug is not on the formulary, you can ask your doctor to prescribe a similar drug that is covered, or you can ask Capital Health Plan to make an exception and cover your drug. There are several types of exceptions, which include the ability to receive a temporary or transition supply of a drug if you are a new member or if your drug is no longer on the formulary while you work with your physician to find another drug. Both brand name drugs and generic drugs are included on the formulary. The drugs in our formulary are organized into different drug tiers. Your copayment or coinsurance depends on which tier your drug is in. You can look up each drug by name in the index in the back of the formulary. The index will give the page number where you can locate the drug, find the drug tier, and any type of restrictions that may apply to the drug. You may also search by drug name on our website. For the most recent formulary, visit our website at www.capitalhealth.com/Medicare. You can also call member services who can assist you. The formulary may change at any time. You will receive notice when necessary. Medicare prescription drug coverage is divided into 3 stages: the initial coverage stage, coverage gap stage, and the catastrophic coverage stage. The program structure and the thresholds to get in and out of the gap stage are determined by the federal government each year. The copayments and coinsurance may be different from plan to plan. It is helpful to know this if you are comparing plans. This slide describes the initial coverage stage in which you pay copayments or coinsurance for your prescription drugs. There is no deductible amount to pay before coverage begins. You will pay the copayment or coinsurance based on the tier level for your prescription drug until the total cost of your drugs reach $4,020, paid by both you and Capital Health Plan in the calendar year. $4,020 is the initial coverage limit for 2020 and can change each year. For a 30-day supply at the retail pharmacy, you will pay $3 for Tier 1, preferred generic drugs $7 for Tier 2 generic drugs, $45 for Tier 3 preferred brand drugs, $95 for Tier 4 non-preferred brand drugs, and a 30% coinsurance for Tier 5 specialty drugs. The specialty drugs in Tier 5 cost at least $670. Please be aware that all tiers include generic drugs. You can get up to a 90-day supply of your maintenance drugs at the retail pharmacy or from our mail order pharmacy, and you will see that there is a cost savings for 90-day mail order supplies using our preferred mail order pharmacy, Alliance RX Walgreens. You may also receive less than a month's supply of certain drugs when appropriate, which can help reduce cost and waste. Your physician will help decide when this is appropriate. Copayments and coinsurance information for other day supplies are located in the summary of benefits. Most members will never leave the initial coverage stage. To determine if you might reach the $4,020 threshold, you will need to know the total cost of your drugs. You can get an idea the cost of your drugs by asking your pharmacy or go to Medicare.gov, where there is a tool available to help you calculate the cost of your drugs while comparing plans. As an example of how this works, let's say your copayment is $45 for a drug and the total cost of the drug is $90. This means that you and Capital Health Plan have both paid $45 each for a total of $90. $90 would apply to the initial coverage limit of $4,020. Next, we will talk about the coverage gap. If the cost of your drugs reached $4,020 during the calendar year, you go into the coverage gap stage, which is also known as the donut hole. The amounts you pay for your drugs may change at this point. If you enroll in Capital Health Plan Advantage Plus or Preferred Advantage, you will continue to pay the same $3 copayment for Tier 1 drugs and $7 copayment for Tier 2 drugs while in the coverage gap. You will be paying 25% for all other generic drugs and 25% of the cost plus a dispensing fee for brand drugs until your yearly out-of-pocket drug costs reach $6,350. The third stage is the catastrophic coverage stage and is the same for both plans. If you reach $6,350 in total out-of-pocket expenses, including the manufacturer's discount, you will pay the greater of 5% coinsurance, or $3.60 for generic drugs, or $8.95 for brand drugs for the remainder of the year. Some individuals with limited incomes and resources may be eligible for a federal program called Extra Help, also known as low-income subsidy, which reduces prescription drug premiums and copayments or coinsurance. To see if you qualify for Extra Help, contact Medicare, the Social Security Administration, or Medicaid. The contact information is provided on this slide. These benefits are not covered by Medicare, but are covered by our plans. Routine hearing and eye exams are covered annually. You can receive up to $150 reimbursement every 2 years for the cost of eyeglasses or contacts based on date of service. You can also receive up to $150 reimbursement each year for membership to a health fitness program or classes. There is a wide variety of programs that are covered, including TOPS and Weight Watchers. Some restrictions do apply. Members have access to our health information line 24 hours a day, 7 days a week. You can talk to a Capital Health Plan healthcare professional about your medical conditions. Dedicated staff are available to provide information and resources regarding issues such as prescription and non-prescription drugs, available self-management tools, wellness and nutrition, and preventative care. We have an online program, CHP Connect, which gives members secure access to personal health records as well as valuable preventive health tools. CHP Connect maintains a personal history of your doctor visits, diagnosis, some lab results, plus much more. There is a healthcare library as well. You also have access to Symptom Checker, which allows you to input information regarding your symptoms, then provides related information or recommendations to seek care based on the results. Anyone can actually use the Symptom Checker link, which is located on our website at www.capitalhealth.com. If you are new to Medicare, your initial enrollment period is a 7-month period that includes the 3 months prior, the month of, and 3 months after your birth month or eligibility month. If you enroll in Medicare or Medicare Advantage plan during the 3 months prior to your eligibility or birth month, your Medicare will be effective the first day of eligibility or your birth month. If you delay enrolling until after your eligibility or birth month, your effective date can be delayed by 1 to 3 months. There is information about enrolling in Medicare in the Medicare Made Easy brochure that I mentioned earlier in the presentation. If you enroll during the annual enrollment period, your coverage will begin the first of the following month between October 15th and December 7th. Your coverage will be effective January 1st. This is the time you can make any type of change or switch between Advantage Plus or Preferred Advantage. January 1 to March 31st is the open enrollment period. Your coverage will begin the first of the following month. During this time, you are allowed a one-time change and can make various plan changes to how you receive your Medicare coverage. You must have a qualifying event for a special enrollment period during the year. Special enrollment periods include moving in and out of the service area, losing group coverage, entering or leaving long-term care or a skilled nursing facility. Dual eligible members and members who receive extra help have a continuous special election period. Your coverage will begin the first day of the following month following receipt of your application. As we discussed, you can travel outside the service area and will have coverage for urgently needed care and emergency care. Some individuals have homes in other areas, which is fine as long as you don't leave the service area 6 months or longer. If you leave the service area 6 months or longer, we are required to disenroll you. Capital Health Plan Advantage Plus and Preferred Advantage are HMO plans with a Medicare contract. The enrollment in Capital Health Plan Advantage Plus and Preferred Advantage depends on contract renewal. This information is not a complete description of benefits. Contact the plan for more information. Benefits, premiums, or copayments, coinsurance may change of January 1 of each year. Limitations, copayments, and restrictions may apply. The material we reviewed today is for the 2020 plan year. You may be subject to a late enrollment penalty if you did not enroll in a Medicare Part D plan when you first became eligible, or if you had a continuous period of 63 days or more that you were not enrolled in a Medicare Part D plan or did not have credible coverage. Credible coverage could be employer coverage, VA, or TRICARE. You may receive a letter from Capital Health Plan to verify prior coverage. Medicare assesses the penalty, but we are required to collect it by adding the amount to your monthly premium. This slide contains our contact information and hours of operation. Please feel free to contact us with questions or for assistance. Appointments are necessary to see a Medicare sales representative. If you have special needs, this and other documents may be available in other formats such as Braille or large print. The Centers for Medicare and Medicaid Services issued new Medicare cards with new Medicare numbers April 2018 through April 2019. They removed the Social Security numbers from the Medicare cards and replaced it with a new Medicare number that is alphanumeric and unique to you. This was done to help protect your identity. If you already had a Medicare card, please destroy it and place it with your new Medicare card. Please keep your Medicare card in a safe place. When you enroll in Capital Health Plan Advantage Plus or Preferred Advantage, you will not use your Medicare card. You will just use your CHP ID when you need services. If you are already enrolled in Medicare, make sure your mailing address is up to date. To correct your mailing address, contact the Social Security Administration at ssa.gov/myaccount or 1-800-772-1213. TTY 1-800-325-7778. 7 a.m. to 7 p.m. Monday through Friday. Cards will be mailed at different times, so you or your spouse, friend, or neighbor may have received your new cards at different times. Please don't share your Medicare number with anyone who contacts you by phone, email, or by approaching you in person, unless you have given them permission in advance. To recap some of what we reviewed today, to be eligible to enroll in Advantage Plus or Preferred Advantage, you must be entitled to Medicare Part A, enrolled in Medicare Part B, live in our service area, and you cannot have end-stage renal disease. To choose between Advantage Plus and Preferred Advantage, review the 4 differences in out-of-pocket costs: inpatient hospital, specialist office visit, skilled nursing facility after 20 days, ambulatory surgical center outpatient procedures. To see what doctors or providers are in our network, look at the provider directory. To see what pharmacies are in the network, look in the pharmacy directory. To find out how your drugs will be covered, look in the formulary. To learn how and when to enroll in Medicare, review the Medicare Made Easy brochure. To enroll in Advantage Plus or Preferred Advantage, follow the enrollment checklist in the enrollment guide. If you want delivery in person and meet with a representative, please call and make an appointment. You can change plans each year during the annual enrollment period. Enjoy worry-free travel since you are covered for emergencies and urgently needed care anywhere in the world. You can get prescriptions filled at network pharmacies anywhere in the United States and all major retail chain pharmacies in the network. For questions, please call our Medicare sales team or member services. Thank you for attending.